An appendectomy in the United States costs an average of $35,000. In Canada, the same surgery costs the patient nothing. In Japan, the patient pays roughly $500 out of pocket. The surgery is the same. The outcome is the same. The invoices are not. That gap is not a rounding error. It is a structural feature of how each country has chosen to fund medical care. This video runs 5 medical scenarios through each system. By the end, the math behind each system will be clear. The 3 countries are the United States, Canada, and Japan. They were selected because they represent 3 distinct approaches to healthcare funding. The 5 scenarios are an emergency room visit, an appendectomy, childbirth, a heart attack, and a course of cancer chemotherapy. All figures are sourced from official government data, peer-reviewed healthcare cost studies, and hospital billing records. US figures reflect average costs before insurance adjustments. Canadian and Japanese figures reflect what a typical patient actually pays out of pocket. One clarification before the numbers begin. The United States does not have a single healthcare system. Costs vary by state, hospital, and insurance coverage. The figures used here are national averages. An insured American pays significantly less than the sticker price, while an uninsured American can face the full bill. Both realities are covered in this comparison. Start with the most common entry point into the healthcare system, the emergency room. A single emergency room visit in the United States, without hospital admission, costs an average of around $2,000. That figure covers the facility fee. Physician fees, tests, imaging, and medications are billed separately. These additions typically add at least $500 more. A patient with good insurance may pay a copay of around $200. A patient with no insurance receives the full bill. In Canada, the answer is simpler. An emergency room visit costs the patient nothing. Provincial health insurance covers the full cost of physician services and hospital care. There are no copays and no deductibles for hospital services. Prescription medications after discharge may carry a small cost, but the emergency visit itself is free. Japan uses a coinsurance model. The government covers 70% of all approved medical costs. Patients pay the remaining 30% directly. A typical emergency room visit in Japan costs the patient around $100 out of pocket. Japan also operates a monthly catastrophic cost ceiling. Once a patient's out-of-pocket spending exceeds a set threshold in any calendar month, the government covers all additional costs above that ceiling. The contrast on this first scenario is already significant. A US patient without insurance owes around $2,500 for a straightforward emergency visit. A Canadian patient owes nothing. A Japanese patient owes roughly $100. The appendectomy ranks among the most common emergency operations performed globally. In the United States, the average total cost of an emergency appendectomy varies widely by hospital. Simple cases average around $13,000. Complex ones can exceed $80,000. The national average sits near $35,000, and an insured patient typically owes their deductible plus coinsurance. That total can reach $10,000 depending on their plan. A patient without insurance receives the full hospital bill. Canada performs roughly 40,000 appendectomies per year. The patient cost in every province is zero. The surgery, the anesthesia, the recovery room, and the follow-up appointments are all covered by the provincial insurance plan. No bill is mailed to the patient. Japan's coinsurance structure applies here as well. A typical appendectomy costs the hospital approximately $3,500 in total. The patient pays 30% of that total. The out-of-pocket cost runs roughly $1,000. If that amount pushes the patient above the monthly out-of-pocket ceiling, the government reimburses the excess. On the appendectomy scenario, the US gap is at its most visible. An uninsured American faces a bill that could equal an entire year of median income. A Canadian patient pays nothing. A Japanese patient pays roughly the equivalent of a monthly utility bill. Consider childbirth next. It is the most common reason for hospital admission in the United States. A vaginal delivery in the United States costs an average of $13,000. A cesarean section averages $22,000. These figures cover the hospital stay and delivery. Prenatal appointments, anesthesia, and pediatric care at the hospital add to the total. An insured mother typically pays her deductible and any co-insurance owed under her plan. An uninsured mother receives the full bill. In Canada, a standard hospital birth costs the patient nothing under provincial coverage. Some provinces offer a choice of midwife-assisted birth in a birth center, which is also covered. Post-delivery care and newborn checkups are included. The government covers the medical costs of bringing a child into the world from start to finish. Japan applies both its coinsurance model and a specific childbirth incentive. Normal delivery is not classified as a medical procedure under Japan's standard health insurance, so the full cost is initially the patient's responsibility. The Japanese government provides a childbirth grant of roughly 500,000 yen. That converts to approximately $3,300, paid directly to the hospital. A standard delivery in Japan typically costs around $6,000. The grant covers roughly half. The remaining patient balance is around $3,000. For an uninsured mother, a US hospital birth costs at least 3 times more than in Japan. A Canadian mother pays nothing for a hospital birth that would cost a US peer $13,000. A heart attack is among the most expensive acute medical events in any country. The cost differences here are the largest in this comparison. In the United States, a heart attack requiring hospitalization averages around $100,000 for the hospital stay, cardiac catheterization, and any necessary procedures. Complex cases requiring bypass surgery can reach $250,000 or above. An insured patient with an annual out-of-pocket maximum of $10,000 pays up to that cap and no more. An uninsured patient in the United States receives a bill that can equal several years of median household income. In Canada, a heart attack patient pays nothing out of pocket for emergency care, hospitalization, cardiologist services, and the required procedures. The cardiac catheterization laboratory, the intensive care unit, and the follow-up specialist appointments are all covered. Cardiac rehabilitation programs are also provided at no direct cost to the patient. Japan's coinsurance model applies at the standard 30% rate, but the monthly out-of-pocket ceiling provides strong protection. A typical heart attack hospitalization in Japan costs around $15,000. The patient covers 30%. That comes to roughly $4,500. If that amount exceeds the monthly ceiling for the patient's income bracket, the government covers the difference. Most heart attack patients in Japan ultimately pay around $3,000 out of pocket for the full acute care episode. The contrast here is stark. A US patient without insurance faces a financial event that can exceed $100,000. A Canadian patient pays nothing. A Japanese patient pays roughly $3,000. And with the costly scenario on this list, a full course of cancer chemotherapy. In the United States, the cost of a chemotherapy regimen varies widely depending on the cancer type and the drugs prescribed. Standard chemotherapy courses can cost over $30,000 per year. Certain regimens exceed $100,000. Newer targeted therapies and immunotherapy drugs can cost upward of $300,000 annually. An insured patient pays their annual out-of-pocket cap, which typically falls around $10,000 under employer-sponsored plans. An uninsured patient is exposed to the full cost. Canada covers the cost of chemotherapy drugs through provincial drug plans and hospital formularies. A patient receiving chemotherapy at a cancer center pays nothing for the treatment itself. Some newer oncology drugs not yet approved for provincial coverage require private insurance or out-of-pocket payment, but standard chemotherapy regimens are fully funded. This includes the drug cost, the infusion clinic appointments, and the laboratory monitoring visits. Japan covers cancer chemotherapy under the National Health Insurance System at the standard 30% coinsurance rate. The monthly out-of-pocket ceiling applies. A full year of chemotherapy in Japan carries a total hospital cost of around $30,000. The patient covers 30% of that total. The monthly ceiling typically limits the actual out-of-pocket to roughly $20,000 over the full treatment course. Newer high-cost drugs in Japan are subject to government price negotiations that keep costs substantially below US levels. Cancer treatment costs in the United States are the highest in the world by a significant margin. A Canadian cancer patient pays nothing for standard treatment. A Japanese cancer patient pays a fraction of the US cost even before insurance adjustments. These outcomes reflect three very different system designs. The United States funds healthcare primarily through private insurance, employer contributions, and out-of-pocket payments. The government provides Medicare for adults over 65 and Medicaid for low-income individuals. Approximately 25 million Americans had no health insurance coverage as of recent federal surveys. The private market for healthcare in the US has produced the highest nominal costs of any country in the world, but Americans with comprehensive employer-sponsored insurance often pay amounts comparable to what Canadians experience in practice. Canada operates a single-payer system where each province funds healthcare through general tax revenue. There are no premiums, deductibles, or co-pays for hospital and physician services. The system does not cover prescription drugs outside of hospital stays, dental care, or vision care, which patients typically fund through private supplemental plans or out-of-pocket. Japan operates a universal social insurance system. Every resident is required to enroll in either employment-based insurance or the National Health Insurance Plan. The 30% coinsurance rate applies uniformly, and the monthly out-of-pocket ceiling prevents catastrophic out-of-pocket spending regardless of how severe the illness becomes. Japan consistently ranks among the countries with the lowest healthcare costs relative to GDP among developed nations, while maintaining high life expectancy and low infant mortality. These scenarios reveal a clear pattern. Here is what the data shows. For every scenario on this list, the United States is the most expensive country. The gap is not marginal. An appendectomy costs 35 times more for an uninsured American than for a Japanese patient. A heart attack can expose an uninsured American to $100,000 in bills. A Canadian patient pays zero across every scenario. The United States spends more per person on healthcare than any other country in the world. That spending does not produce better average outcomes. Life expectancy in Japan and Canada both exceed the United States. Infant mortality in Japan is among the lowest in the world. The cost of getting sick is not determined by medicine, it is determined by the system that surrounds it. In Japan, a 30% coinsurance rate with a monthly ceiling means that illness is expensive but never financially catastrophic. In Canada, illness is effectively free at the point of care. In the United States, the cost depends almost entirely on insurance status, and for the uninsured, it can be life-altering. The numbers are in the description with full sources. If this breakdown was useful, subscribe. New comparisons drop every week. Drop a comment with the country or medical scenario you want to see covered next. Sources for all cost figures are listed in the description below.